Buena Vista Home Health, Palliative Care, and Hospice Care. I brought enough of these for everybody. This is a real quick snapshot on compare the differences, hospice, palliative care, and home health. And this column is what the insurances, Medicare and other commercial plans will pay for home health, palliative care, and hospice care. And you just follow the grid across and you can see what's covered. So that's that.
That's helpful.
Oh yeah,
That's helpful.
Very,
Yes.
it is. But I'll just give you a snapshot of the three levels of skilled care. We don't compete with home care. We complement each other because they do things we don't do and we do things they can't do. So, and we love hospice. Anyhow, what is traditional home health? And I'm going to read this, otherwise I'm just going to babble. Traditional home health care provides a variety of home health services to meet the medical needs of patients in the comfort of their own home, as well as residential care facilities and assisted living facilities. Traditional home health services are for individuals who have a skilled medical need, are essential. Homebound. Now that doesn't mean they're bedbound. Homebound means that they just have difficulty getting out. They need a walker or a wheelchair or the assistance of another person. And a physician who has certified the need for home care. So some of the services from a home health nurse would be pain and other symptom management, med management, intravenous therapy, diabetic management, wound care, dressing changes, catheter care, and on. And for rehabilitation services, we have physical therapy, occupational therapy, home health aides for personal care, bathing, and so forth. Medical social workers, they provide emotional support and resources if other services need to come in for care. And we are available 24/7 on the phone. What is palliative care? The philosophy of palliative care. It's a fairly new program. It was developed within the home care management system, and it's part of the Medicare home health benefit. It can serve in some cases as a bridge between traditional home health and hospice. Some people cannot hear the word hospice. No way, Jose. But they can hear palliative care.
Yeah.
So sometimes the patient will come on, even if they're perfectly in need of hospice, they'll come on as a palliative patient, and then once they realize that, pretty good people, we're bringing in good care, they'll move into hospice. And sometimes, not sometimes, all the time, palliative care, the word is confusing because hospice is truly palliative care. So here we've got this whole home health piece that's palliative care. So that can be a little confusing. So let's see here. All hospice care is palliative care, but not all palliative care is hospice. So palliative care is appropriate for painful, serious, deteriorating, complex, or life-threatening illnesses such as cancer, CHF, COPD, kidney failure, Alzheimer's, Parkinson's, ALS, and so forth. And we also provide all the nursing care for, like I mentioned, in home health, and let's see here, a lot of emotional support. These people don't know if they're going to improve, go back to home health, or they don't know if they're going to get moved into hospice. So there's a lot of emotional support that needs to be provided there. And we are also available 24/7 for those services. What is hospice care? The philosophy of hospice care is that it emphasizes on palliative comfort rather than curative treatments. It is designed to meet the unique needs of patients and their families facing a limited life expectancy. Hospice care provides physical, mental, emotional, and spiritual comfort while allowing nature to take its course. The hospice is not just for the patient, it's for the family too. That's because sometimes it's harder on the family than it is on the patient. So services that are offered through hospice are physician visits, weekly nurse visits, 24-hour on-call nurses, durable medical equipment and medical supplies, medications related to the comfort of the terminal diagnosis, a certified home health aides for personal hygiene, social workers, spiritual care, volunteers, grief support, evolving care plan, caregiving education, and advocating for the patient and family. Also 24-hour support. And I brought some of these too because this goes into much more detail than the brochure does. So take what you want, but a couple things that make us different. And I know I've shown Babo to this group several times. He's still with me. So in our bereavement arm, we have a memorial bear program, and so we'll ask the family, was that Dad's favorite shirt? Oh, he loved that shirt. We'll make a bear out of it for you. And then we give it back to the family to treasure. We've been asked to bury vials of ashes of their loved ones inside the bear. We always try to match the eyes to the blue buttons, brown buttons, to the eyes of the patient. But I love this. This is my own Babo. He was my adopted dad. And I can still see him sitting in his easy chair in this chair. And in this chair, in this outfit. I'm probably over 5
You're making me cry, Lance.
I know, I love that we do that. We don't have to do that.
Yeah.
And another big thing that we do is our butterfly remembrance ceremony. And it's going to be September 19th, if you want to put that on your calendar. We release 500 plus butterflies. This little gal, she came on a bus with her community in Thousand Oaks, and when she released her butterfly, it landed on her cheek, and it wouldn't leave. And she was convinced that that was her sister Betty saying, "I'm okay." So, do I have another minute? No? Yeah?
Finish.
Okay. Real quick. So, she went back to her community and she wrote this poem, which her daughter sent to us. And I can finally read it now without crying.
Yeah.
I'll just be in a second. Butterflies. Today I sent butterflies to Betty to tell her how very much I still care. One came back and gave me a peck to tell me my message went through. For sisters will always be sisters and our thoughts will always be there. So please send thanks to the butterflies that connected us once more. This event has a lot of meaning
I need a cleaner.
We hear closure all the time, just because they believe that their loved one is letting them know they're okay. So anyhow, thank you. Going to miss